Hello, hello. Welcome, everyone. We're super excited to have you join our first webinar, our first health insurance webinar in Latin America. This new that West Africa. We are excited to bring on to for you guys. Andela has partnered with SafetyWing, and today is the day to learn everything that there is about SafetyWing, their mission, the terms that they offer into our wonderful Andela community, and also ask any burning questions that you guys might have. So before we go ahead and get started, I would like to know where you're all joining from. Please let us know what city and country you're joining in today, and I would love to see sort of the geographical breakdown of folks. For those who haven't met me before, my name is Stanislav. I go by Stas, Stas. And I am in charge of the health insurance program here at Andela for our contractors. So some of you might have spoken to me. Some of you might have seen some, surveys coming in from me, interviews and stuff like that. So I'm really excited to be showing my face so you can see what I actually look like. Um, this is again an exciting moment for me as well. I joined Andela fairly recently, about half a year ago in May this year, and I'm based out of New York City. So we have outside of me, we also have SafetyWing joining today. So we have Mar joining us today from SafetyWing. She's our account manager. She's also joined by Sarah. Sarah will be helping out answering questions as they come in. And I'm also joined by Oscar. He is going to be on the back end of things today. He is on the marketing team, and he helps to set up webinars and make sure that they run smoothly and everything looks organized and well maintained and all stuff like that. So thank you so much, guys, for being here today. So with that, I'm going to pass it over to Mar to introduce herself, and then we will get going.
Of course. Thank you so much for the warm welcome. I'm super excited to be here. And as Stan mentioned, I'm Mararango. I'm an account manager at SafetyWing. I'm usually based in Medellin, Colombia, and my job is basically helping our members with questions about coverage, claim, or any medical procedures. So if you have questions, just let me know about it. Write us on the chat, and I'm here to help you out.
Concerned. So let's go ahead and run the first poll to see if you guys currently have a health insurance plan or not. Just would be interesting to know if you just sort of joining in to kind of learn about what's being offered today. Maybe you already have a plan, or if you're joining in to actually don't have a plan today and you're joining in to learn what's being offered. So let's go ahead and let it run for a little bit. Mara, where in Colombia are you today?
I'm in Medellin,
What
Colombia.
city? Medellin. Okay, cool. How's the weather there?
Oh, it's wonderful. We're about like 25 degrees right now. So it's
Oh
the
my
perfect
gosh,
weather.
that sounds
This city is
amazing.
called the
Yeah,
the eternal spring city. So it's our weather is the best thing we have. So let's enjoy it.
that's awesome. Alrighty, so let's go ahead and take down the poll and see what we have going on in the poll. So I see we didn't get a lot of responses, but I do see that some of the folks that did respond said they do have a health insurance plan, which is great. I mean, it's always kind of good to be on the lookout for anything new or advantages that might be available. So that's great that you guys are joining in today to see what's being offered through SafetyWin, and maybe in the future that would be a good fit for you. As well. So with that said, we're just gonna go ahead and have a little bit of conversation first to learn more about SafetyWing. So Mar, I mean, SafetyWing, I think SafetyWing and Andela just in general have a very similar mission in a way that we are looking to empower underserved communities, especially, and bring in affordable, you guys are bringing in affordable health insurance options. And that's a great sort of mission on its own. But tell me about you personally. What excites you? What gets you going every day to go back to Safety Win and do the work that you do?
Oh, I was talking about this just a little bit earlier today with my boss, and it's so hard to put it in words because it's so many emotions. Like we are working for a mission to create a global safety net for everyone to enjoy, to have the best benefits they can. And this project came out of three Norwegians that in their country they had all the benefits, all the coverage they can think of, but once they cross the border, like they stayed in their own country. So thinking that we are building something like that, but for everyone everywhere, for your home country, and if you want to travel, and if you plan on moving, and if you're a remote worker, like it's really thrilling to know that we're working on something that it's really going to impact the future. So it's really, really exciting.
Yeah, absolutely. So tell me about what do you like most about partnering with Andela?
Oh, that one is really interesting because we, as you said, our missions do align a lot. And well, Andela is working basically to erase those same borders that we're talking about. That geography is not a problem for you guys, for getting jobs, for helping people get more opportunities. So we come just at the same time as you guys to provide those same people, those same members with the best coverage they can for their own personal needs, for their health, for their retirement. We are working on creating like a lot of products that will help exactly those members. So if our missions align so well and we are focused on the same people and we are working for the people. So this is really exciting. I'm super happy to be here working and partnering with you.
Awesome. Yeah, I would add in from my end is that the health insurance program ultimately is designed to bridge the gap between being a full-time employee and contractor, right? When you're a full-time employee with a company, you usually have health insurance benefits paid for and stuff like that. When you contract, it's not actually the case. But us bringing in this affordable health insurance options where the premiums are super competitive and coverage is very comprehensive, right? They get outpatient, inpatient, dental, vision for very reasonable costs. That's actually us bridging that gap, and I think that's personally why I'm so excited about partnering with SafetyWing, and especially the fact that you guys are kind of global. You have a global outreach as well, so that's amazing. Andela is very global. We are represented in a lot of different markets around the globe, so that's just I think a marriage made in heaven, so to say.
I totally
Awesome.
agree with it.
Okay, cool. Perfect. So this was just a little bit of information about the Safety Win and our partnership, you guys. We are gonna do the presentation just in a little bit, but before we do that, I would go into and like to run second poll and see. So if I see that some of you already have an insurance plan, but I'm just curious to see how many people would you be interested to insure? Would it be just yourself and partner, yourself and family? If you do already have an insurance plan, go ahead and feel free to answer that as well. Just want to get an understanding of where do you guys stand today in terms of insurance needs. Okay, so it looks like we already have some responses coming in for this one. For the previous one, we have about a 60 to 40% breakdown of folks that already have an insurance plan and folks that are looking for one. So that's good to know. Alrighty, so we got a few responses. So let's go ahead and take it down for now. The poll will still be available to you guys in the poll section, so you can see that on the far right side. Feel free to go ahead and answer that. Also, I just would like to remind you guys that this webinar is hosted for you. So this is a great opportunity to not only learn about the terms and the premium breakdowns and everything that has to do with health insurance, but also ask your thoughtful questions. I know I've seen a lot of engagement in the community already after we announced the partnership, and some people have already set up a call with me. Some people message me directly with questions and stuff like that. I know there are still a lot of questions out there that you guys are looking to get answers. So feel free to go ahead and submit your questions. There is a Q&A section at the very top, on the far top side. So you can click on the Q&A and you will be able to send in your question. Once we will have questions in there, you can also send them in the chat if you'd like. But at the very end of the webinar, we will go ahead one by one, else each of the questions. So feel free to utilize it as Mar goes through the presentation. If there is a question that pops into your head, just go ahead and type it in, and we'll get it answered at the very end. Alrighty, so with that, we are going to move on to the presentation by Mar. Mar, it's all you.
Thank you. Thank you. Well, thank you so much again. And well, welcome to the nest, as we like to call it. This is a bird company, so feel like one of ours. So during this call, I will explain the plans, how you can enroll it, and how to use your benefits. So a little bit about SafetyWing. We are building a global safety net for remote workers and seeking to change the world for the better. I'm going to talk today about remote health. This is a comprehensive health insurance that will follow you wherever you are. One of my favorite advantages about SafetyWing and about remote health is our worldwide network. You can use your insurance with any private or public hospital or doctor anywhere in the world. As your health doesn't know about borders, we don't know about those either. So you can rest assured that you will be covered both home and while traveling. You can choose to enroll in any of these three options. The standard, the premium, and premium plus maternity. All three plans include a core package, outpatient benefits, and a zero deductible. I will explain this a little bit better in the next slides. So remote health will cover for a mixture of medically necessary treatment and any routine care. So medically necessary, what is that? So that is basically if you have an injury, an illness, a disease, or if you need anything that needs to be addressed by a medical professional. A routine treatment, on the other hand, is if you're not experiencing a symptom, but more like you just want to check out a routine, just for checkups. So these will include physicals and screenings and blood work. The standard plan only covers for medically necessary treatment, and this plan has a 10% coinsurance for outpatient claims. So let me give you an example. If you have a claim for $100, SafetyWing will be covering $90 out of those 100, and you will be responsible for the 10 remaining dollars. On the premium and premium plus maternity, you have a zero coinsurance, so you will be reimbursed at 100% of your bill. The following benefits are only available under the premium and premium plus maternity. You have dental, $1,500. This is for cleanings, checkups, treatments like crowns or fillings. Vision is $500 for eye exams, for glasses, or contact lenses. Screenings, as I said, it's something more like checkups and preventive services. So here you will have coverage for annual blood tests or physicals. The maternity is only covered under the Premium Plus Maternity Benefit Plan, and here you will be covered for medically necessary costs, including pregnancy, childbirth, and pre- and postnatal checkups up to 30 days following discharge. In this benefit, you have $7,500, but you have a 20% coinsurance. So for any claims, just as the outpatient coinsurance, you will be responsible of 20% of the bills. Enrolling in remote health does require a 12-month commitment, and the cost of the coverage is billed monthly. Pricing is really simple. Just choose your plan and check how much it costs according to your age. In case you want to add family members, they will have the same plan as you are, but their price will vary according to their age. The core plan includes a $1.5 million maximum coverage. This includes things like emergency room care, hospital stays, and surgeries. Just let me give you like an example. In case you need a surgery for any condition that you have. So what do you have to do? First, you call your doctor, schedule an appointment, and get all the documents you need. Any medical notes, test results, and the estimated cost of the treatment that you require. Then go into your website and into our website and your account. And there you will be able to log in and click on the Notify form. fill the form, and we will start working on it immediately. Once we receive that notification, you can rest assured that one of our SafetyWing members will be reaching out in case there is anything that we need or once it is approved. Using the outpatient benefit, here you will have a $5,000 maximum coverage, and this includes things like doctor visits for illnesses, even if you want to see a specialist. By the way, if you want to see a specialist, you do not need a referral from a general practitioner with us. Here, you are also covered for physical therapy and much more. Remember, the standard plan has a 10% coinsurance for these types of claims. So how to use it? Really easy. It's just 4 steps. First, call your doctor, just as the one with inpatient care. Then pay for your visit. Just have everything that you need, pay for your visit, keep the receipts, the invoices, the medical notes, and again, go into your SafetyWing dashboard, submit all the information where it says make a claim, and then you will be reimbursed in the account that information that you provide. So how does payment work if you need to see a doctor? As I said, you have 2 options. So option 1 is the most used one and the easiest one. It's just pay out of pocket and submit a claim. So as I say, go to your doctor, pay for your visit, keep your all the documents, and submit a claim. For option 2, you have direct billing, and this is for any inpatient or day patient treatment. So in case you need SafetyWing to be paying for these services, and these services are over $250 or the equivalent to your currency, then SafetyWing will be paying for those, and you will need to notify us and have a pre-authorization under the same notify link. I really hope you never find yourself in an emergency situation, but it's really important to understand what to do in case you're there. So first of all, go straight to the hospital. We want you to seek medical attention right away, and your health is what we are most cared about. So also, just as a reminder, be sure that you're printing a copy of your insurance card. You will find this in your SafetyWing dashboard as well. Just print it out. There you will find all of the numbers and emergency contact numbers, so you can have it handy. If you're at the hospital, just ask the medical facility to contact us, and that's it. We will get things running. We get it. Sometimes your life changes, but no worries. We're here for you. As you've learned, remote health provides with global coverage, but there are still some countries that are outside our area of coverage. So, for example, if you want to travel to the United States, Hong Kong, and Singapore, there you will have a 30-day maximum coverage for emergencies only. You can also add dependents for an extra cost. You will be able to do so while signing up and while joining SafetyWing. You can either add partners or children. If in case you want to add dependents in the middle of your account, you can do so only if there is a qualifying life event. What is that? So if you're getting married or if you have a child, then that is a qualifying life event to add dependents. Remember that we are always here for you. We have an amazing customer service chat, and it's available 24/7. Just go into our website, write us on the chat, and we will be helping you with anything that we can. Also, we had an amazing frequently asked questions sections on our website. So if you have questions, and you will most probably find the answers there. So you can click either on the presentation or just go into our website. So if you're still interested in remote health and in our product, be sure that you go into the Andela website, fill out the form, and you will receive an email from SafetyWing that looks just like this. Activate, please follow all the steps and click follow all the steps, provide all your information, and just select the plan that you want, the start date, and you're set. You will have coverage with SafetyWing. So let me also explain how to use your dashboard. Oh, sorry. So first of all, log in with your information. You get to be one of us if you want. So you can personalize your bird however you want, with the hair color, any type of features that you want. And we want you to feel like just like one of us. You can click here on remote health and you will see your dashboard and all of your information. Your you will see that your coverage is ready, the benefits that you have, and if you hover over the question marks, you will find a summary of the benefit. Here you will also find the policy document where you will find everything regarding our coverage. Also the exclusions. So if you want to go there, just go into section 7 and you will find all the information in there. You will also find a really simple way on how to use our dashboard and how to use your insurance. You will find here all the information. Also the form to notify us or to ask requests for direct billing. Also the make a claim button. Will be really useful for you. Just fill out the form and you will be reimbursed on the account that you select. This is your personal card. So print it out. You have all the contact numbers in case you need them. Just print it out, keep it in your purse, and we're ready to go. So thank you very, very much for having me here. I'm really excited to be here, to be explaining you about SafetyWing, and I'm really excited about this partnership. So let me know. It's question time. How can I help?
Uh, Thank you so much, Mar. That was amazing. That was a great presentation. And also, I've done a few of these webinars. So usually it's like kind of heavy and kind of hard to process, but yours was very light, very
Oh,
understandable.
I'm so
And
happy to hear
yeah,
that.
yeah, actually one of the best presentations I've gotten so far. And
Oh,
I've done a
that's
few of
awesome.
those. So I don't see any questions coming in. So I think maybe folks are a little shy, but that's fine. Just a reminder, you can send your questions in through the Q&A section of the chat. I do have a question. So I saw that you guys have a direct billing available for claims over $250. So how does that work? How would one set up direct billing?
So if you need to set direct billing and you want SafetyWing to
Mhm.
be paying for your services, it's really easy. Just go into the notify or direct billing link that I explained on the dashboard and
Mhm.
fill out the form. Be sure to have all the documents that you need. If you had previous like test results, if you have medical notes,
Mhm.
if you have prescriptions, just provide us with the most, like all the amount of information that you have,
Mhm.
because with more information we have, it's easier to approve. And once it
Mhm.
is approved, just you can rest assured that SafetyWing is paying for your services and that we
Mhm.
have arranged direct billing with your provider, and you don't have to pay anything.
Okay, got it. And for direct billing, it's something you would do if you like anticipating a visit, right? An appointment or like maybe a surgical procedure. It's not something you can do retroactively for like a past a visit in the past, right? You would do it
No,
for
exactly. It has to be requested in advance. Obviously, in emergency situations, just go to your provider and just let us know that you're there and that you want SafetyWing to be
Mhm.
paying for your emergency care. But otherwise, it has to
Mhm.
be previous the procedure.
Awesome, great. So I had a question that came in earlier this week, I believe it was, maybe last week, about mental health. Could you go through the what's available under the mental health realm,
Of course.
and which plan would cover those benefits as well?
Okay, so we have two ways of covering for mental health. So we have first inpatient care, that all of the plans include this type of care. So for inpatient care, if you are admitted at a facility for any mental health condition, you are covered for up to 30 days hospitalization. In case you are visiting just for an outpatient care. So if you want to go to see a psychiatrist or something like that, you are also covered under the outpatient benefit. So this is not on the base package, but on the outpatient benefit. Again, it is covered in all of the three plans. Just remember the coverage for the standard plan has a 10% coinsurance. The other ones you will be fully reimbursed. Um, there you are for psychiatric care. And in all of the three plans, again, under the outpatient benefit, you have something that is called complementary therapies. here you're covered if you want to visit more like a psychologist rather than a psychiatrist. Then you are also covered under these complementary therapies. Here you have 10 sessions per policy year and would fall under that benefit. These sessions are covered for up to $60 each. So if your appointment, for example, with the psychologist costs $80 each visit, SafetyWing will be covering for $60 and you will be responsible for the remaining $20.
Okay, so basically they have a 10 visit limit under each of the plans for a therapist, correct? But under the standard plan, that would be a car insurance they have to pay. And then the psychiatrists, if they needed to see like a psychiatrist or maybe even be admitted. Oh, no, let's talk about maybe visits for now. If it was a psychiatrist visit, that would also be covered under all the three plans, correct? Or just the premium?
And you No, these ones
No.
are also covered on all the
Mhm.
three because it's under the outpatient. And outpatient in all of the three plans, you have $5,000 of coverage. Each visit
Mhm.
for psychiatrist is covered 100%. Well, with
Mhm.
the standard plan, you have a 10% coinsurance, but
Mhm.
you will be covered for up to 10 sessions of
Ten sessions.
psychiatrist and 10 sessions of psychologist if you want under the
Mhm.
complementary therapies.
Okay, sounds good. And then there was another question that actually came in this week, and it was also about seeing a specialist. So, is there usually like a 10 visit limit for every single specialist, or is it just does that
No,
only apply to? Okay.
that only applies to psychiatric care. With
Mm-hmm.
other like specialties, you can visit as many
Mm-hmm.
times as you need. Um, in complementary therapies, you're combining, like you can mix it however you want. So you have 10 sessions of complementary therapies. Here you can like have osteopath care if you want to visit a chiropractor, a
Mm-hmm.
psychologist. So however you want to use those dozen sessions, these are like the things that you have covered.
Okay. Yeah, those sound like more like supportive services, right? Chiropractor and therapy and
Exactly.
stuff like that. What about the ones that kind of more serious? For example, I don't know, maybe someone has a like an nose infection and they have to see an ENT, or maybe they have I don't know, some sort of a condition that where they have to see a specialist on a regular basis, maybe once a week or
No,
so. Yeah.
those you have full coverage on all of the three plans. So you
hmm
can visit as many specialists as you need.
Mm. As long as you have a medical need for it, right?
Exactly. You need to
Okay.
have a diagnosis and a
hmm
reason to visit these these doctors. But yes, as long as you have a
hmm
diagnosis, you're covered for them. If you are visiting a doctor or a specialist only as a routine checkup, for example, myself, I go to the gynecologist each year just to see that everything is all
hmm
right. Even though this is a specialty, I'm going and I'm visiting and consulting only because for a preventive service. So that would fall under the screenings benefit, and this is only covered under the premium and premium plus maternity. The standard does not have coverage for those specialties that are only for
hmm
checkups.
That's good. Well, that's great. So, question I had was regarding the maternity benefit. So, so let's say we have a couple. It's for the sake of the example, if it's a husband and a wife, and they are planning to have a baby. So for would they both have to then get the maternity premium plus maternity plan to for the wife to be able to utilize the benefits under that plan, or would that be enough if husband gets maybe the premium plan and he purchases the premium plus maternity for his partner?
Well, if they are joining as dependents, they will both have the same plan. So in case the policyholder
hmm
is the man and he wants his wife to be covered under the maternity, he has to have the premium plus maternity so his wife can also apply for the same coverage.
Got it. Okay. Cool. So another question that came in as well was about pre-existing conditions. Is there like any sort of difference between the standard and the premium plan when it comes to taking care of pre-existing conditions outside of just the co-insurance
Uh,
term?
Pre-existing conditions are covered under all of our plans. Just remember, so for example,
Mhm.
something that could not be covered, but it's a pre-existing condition. So I had cancer. I no longer have it, but I used to have cancer. So of course, that is
Mhm.
a pre-existing condition, and you will be covered for it. But in
Mhm.
case you have the illness again, but for example, if after that disease or this illness, I end up having to visit a doctor for checkups just to see that I don't have any condition or it does hasn't come back. Then those visits would be considered screenings because you don't know and you're just visiting just to
Mhm.
be sure, just as a checkup. So that is really
Mm,
important to
okay.
understand. But otherwise, if you end up having
Mhm.
any condition that you had like a your shoulder hurts and then your coverage starts here and you want to visit your doctor because you have this pain, you will be covered for it without any problem.
Got it. And so for screenings, I see there is a $500 limit, correct? Under the premium and premium
Exactly.
and plus maternity. Okay. So screenings would only be covered under they will have to get at least a premium plan for that. And then so a screening would then be like an appointment, like a regular checkup appointment, right? Maybe with your physician, something like that, right?
Yes.
Okay, and so you can have as many of those as you need, as long as it's within $500, right? If it's more than
Exactly.
that, they will have to pay out of pocket. Correct.
Yes,
Okay.
exactly.
Okay. Cool. Awesome. And what about vaccinations? I see it's also falls under the $500 limit as well. Are there any exclusions as far as vaccines are concerned?
The exclusions we have is COVID-19 vaccines, since these are being handled by
Mhm.
governments. So that one is
Mhm.
not included. But if you need other vaccines like yellow fevers, things like that, you are covered for those.
Hmm. Okay. Yellow fever would also be covered, you said?
Yes.
Yeah. Oh, nice. Okay, great. Perfect. Awesome. Alrighty. Well, those were the sort of the questions that have come up in the community before the webinar, but today we see that everybody's sort of shy. I'm gonna Oscar, let's go ahead and run the last poll for today. So based on the presentations you guys got and some of the questions that were answered, let us know what plan you think you would be most likely to go ahead and sign up for. Again, the standard plan has really good high limits for outpatient and patient care. So for inpatient, we're talking $1.5 million, outpatient $5,000. It does come with a 10% co-insurance copay. The premium plan has everything covered outside of maternity. And premium plus maternity plan covers you in case you're looking to expand your family. So let us know what you have in mind there. With that said, I think we actually doing really great on time, so we do have a bit of time left. But since we don't have any questions, we will probably go ahead and wrap up for today. We can go ahead. Let's go ahead and take down the poll for now. If you guys want to, you can still respond to it in the poll section as well. Just as a summary, this is a new partnership in Latin American market, currently available in Brazil, Colombia, and Mexico. So if you join in for one of those countries, or you have friends in Andela that currently based out of those countries, this is a great offering for them. We're super excited to bring it. It was a long time in making, but finally it's here right before the new year. So that's super exciting as well.
Amazing.
Um, yeah, so I can go ahead and celebrate New Year's with peace of mind at this point. We did it, so that's great. So in case you guys are looking for some more information, we will be sending communications right after so sometime next week with the recording of the webinar, with some useful materials and links and stuff like that. So you will have it available to you. In the meantime, if you have any questions, you can reach out to me on Slack. You can also access the information at the help center, help.andela.com. You can go under the community section, health insurance, and find the information related to Brazil, Mexico, and Colombia. There are a lot of really useful resources there. If you already made up your mind and you know that you want to move forward, you will just go to the Andela Health Insurance page, you submit your request, and from that point on SafetyWing will send you an invitation. So it'll be an email, you will just open it up, and you go through all the steps. So it's all very easy and intuitive. You select your plan, and the next thing you know, you already have health care coverage. So I think SafetyWing has done everything they could just to make it as easy for you guys as possible. Simple, so pricing model, simple plans. Everything is documented, super transparent. So there's everything you need to be successful in your life. And health insurance is very important because not only lets you protect yourself and your family as well, but also kind of protects you from sort of financial burdens in the future, right? We never know what can happen, and so it's just a nice sort of Christian to have to be on the safe side. I up for today. I don't see any more. I can somebody will submit a few questions, but no. Again, you know how to find us. Thank you so much, you guys. Thank you for joining. I saw some folks who are joining from Brazil and Colombia. That's amazing. I hope you have a wonderful night and an amazing weekend as well. It's right around the corner.
Thank you so much, Stan. This has been amazing, and well, I'm really happy to welcome everyone to join SafetyWing as well.
All right.